The pandemic is worsening the opioid crisis in Canada. Statistics Canada reporting from April 2020 to March 2021, deaths from apparent opioid overdoses increased 88% when compared to the same period just a year earlier. But a new wearable device is being developed at the University of Washington, and it could become a life-saving tool for people who overdose. Joining us to explain how it works is physician-scientist Dr. Jacob Sunshine. Welcome to Your Morning.
Good morning.
We're going to bring up a picture of this device for our viewers. If you could explain to us, how does it work?
Great.
I haven't seen it yet, but the picture is coming, Dr. Sunshine.
Okay, yeah.
In the meantime, you let us know. Here it is. So how does this work?
Yeah, so what you're looking at is a reservoir and injector system in the blue and white that contains the opioid overdose antidote naloxone. And then on the right, you have a sensor package that can detect people's breathing. As you're aware, when people get into trouble and have opioid toxicity events, they stop breathing, and this device can detect it and then inject the opioid overdose antidote naloxone.
This is an amazing, amazing development. And I can see it looks like it's somewhere on their body or in their torso as opposed to like on an arm.
Yeah, that's correct. Yeah, in the study, we put it on people's abdomen, either on the right or left side.
This device was tested here in Canada, in Vancouver, at a supervised injection facility. What kind of results did it produce during those tests?
Yeah, so in the tests with our partners at Insight in Vancouver Coastal in Canada, we just tested the respiratory monitoring aspect of the system. So we were able to ensure that we were able to detect breathing patterns associated with opioid self-injection, because we're able to collect that data in sort of a safe and monitored environment. And then in Seattle, we tested the other component of it, where we had people simulate overdose type breathing, and then to ensure that the naloxone injection got into their body, and then we checked their blood levels to confirm that the naloxone did in fact reach their circulatory system.
I think one of the things I appreciate the most about this device is understanding that more than half of these overdose deaths occur when someone is alone, when they're not there to be able to administer the naloxone. So this would help to reduce that number. It also has Bluetooth capability that can be used to notify emergency services if there is an overdose happening.
Yeah, no, that's a great point. Yeah, tragically, a lot of these things happen when others aren't around, or if others, even more tragically, people may be around but just not witness that somebody is in trouble. So Bluetooth capability offers a number of things, all of which we would, have someone who's using the system opt into. Not everybody may want emergency medical services contacted. They may want someone that they know personally contacted. And so Bluetooth capability and now would enable both of those functions.
Yeah, one of those concerns is that, at least in the Vancouver area, it would be police that would show up, perhaps, to help with the overdose, which is something that maybe users wouldn't be interested in.
Right. And so in our subsequent designs, we're going to get feedback to make sure that the device can sort of meet the needs, values, and preferences of people who would be utilizing the device. How
soon could we see this rolled out to the public here in Canada?
Yeah, so devices like this would require approval from regulatory bodies such as the FDA. Fortunately, FDA, recognizing this is such a big public health problem, are interested in sort of making sure that these devices can efficiently get to the people who need them. So next steps involve working with them to ensure that the system meets all of the regulatory requirements and safety standards that would be necessary for a device such as this.
Yeah, here in Canada, they've been calling the opioid crisis the parallel crisis to the pandemic. I know that it is increased awareness down where you are in the United States. Dr. Sunshine, thanks for coming on this morning.
Thanks so much for having me.
Hey, thanks for watching. If you liked this, be sure to subscribe here, or you can check out more Your Morning videos right here.